Well, when I finished my PhD, I went to work at the UAB Lung Health Center, and my mentor, Dr. Bill Bailey, was doing a study in school-based asthma. And I didn't know anything about asthma, had not been in schools, but it was really fascinating to me, one, to look at the conditions under which our schools were trying to operate, and then we were asking them to do something on top of that, which was take care of children's health care needs. So it was really fascinating for me. I got to see how invested the nurses and the school staff were in children's health, and so that's what I've been doing for the past 20 years. In Arizona, about 11% of kids have asthma. It's a little bit higher than the national rate, which is around 9%. We don't have any specific reasons why, but that's about 175,000 children in asthma with Arizona, so it is a significant problem for children. Well, there are a lot of triggers for asthma, a lot of triggers in general for all people with asthma. So for example, cigarette smoke is a lung irritant, so it's a trigger for people with asthma. Allergens, a lot of people that have allergies also have asthma, so any type of allergen can be a trigger for asthma. Perfumes, here in Arizona, dust is a major problem, as well as ozone. So when we have very poor air quality days, this affects people with asthma. And then exercise is a common trigger among kids. So when they're active, their asthma gets worse. And finally, respiratory infections. So many of us will get a cold and we'll get sick, but the child with asthma will get a cold and then they'll get an asthma exacerbation and may end up in the emergency room or the hospital. So it's very significant for them. Well, I'll start by giving you a little bit of history about the program. So when I moved to the University of Arizona in 2009, I was approached by the Sunnyside School District. So Dr. Jody Disney called me up probably the first week I was here in Arizona, and she said, hey, I hear you're new in Arizona and you work with schools. She said, I have a program that I want to implement in my school and I need your help. So when she told me that she wanted to do a stock inhaler, I was very excited because I've worked with schools for the past 20 years, and one of the most common problems in schools is that children don't have their rescue inhaler when they need it. So every child should have a rescue inhaler if they have symptoms. This is the medication that opens up, that relaxes the muscles and allows them to breathe. But there's lots of reasons kids don't have it. Maybe they don't have the money for a second inhaler at school, maybe they lost it, maybe they just don't know where it is that day, it might be empty. And so Jody had read about stock inhalers and really wanted to try that in her school district. So Sunnyside was the perfect place to start because an inhaler is a prescription medication. So you need a prescription and you need a physician's order in order to use it. So they had a nurse in every school, and legally only nurses can implement a physician's order. So at the time we got a standing order from a physician here at the University of Arizona that nurses could use this inhaler in any child that had asthma. And so we were able to test out the program. We saw reductions in 911 calls and EMS transports just in the single year that we had introduced it. And so that was really kind of what got the ball rolling, and what made us get started was that this district was so forward thinking in terms of what they wanted to do with health. And after that, Tucson Unified School District contacted me and said, we don't have a nurse in every school, but can we think about how to do this? And so we were able to use some of the nurse delegation laws to implement it in Tucson. And from there, we realized some of the strengths and weaknesses of the program as it existed, and started studying laws that had been introduced in other states, and realized that we needed legislation as well. Yeah, so our big partner was the American Lung Association, both nationally and the local lung association. They had really helped other schools and states pass these laws. So I contacted the national office, who put me in touch with Joanna Struther here in our local office, and Joanna really did a lot of the legwork. She pulled the legislation from the other 8 states that had existing legislation. We went through it with our school districts and what we had already learned, and determined what would work for us and what things we might want to change. And then we got very lucky that we already had a stock EpiPen law here in Arizona. So Joanna contacted Representative Carter, who is the chair of the House Health Committee, and she was the one that had put forward the stock EpiPen, and she was willing to sponsor our legislation. So she helped us through the process, and myself and Dr. Gerald went and testified. The Arizona Asthma Coalition, Barbara Burkholder testified. We had several people from school districts come and testify. Thayer Medical, which produces the light air spacer that we had been using, came and testified, and we had lots of people sign in support of the bill, so it was exciting. Well, I guess I was a little naive. I thought you passed legislation and then everything just happened. But I realized very quickly that that's not the way it worked. So we were very lucky in Pima County that Banner University Medical Center and Thayer agreed to help financially support the program. And so with their assistance, plus we have a graduate student, Ashley Lowe, who's working on her PhD in health behavior and health promotion. And Ashley put together all the forms and documents that schools would need, because this is one of the things that I was learning. So we had the legislation, but then there's all this paperwork that needs to be created so that schools can meet the laws. We had to create policies for school boards to approve. We had to go to the state school board for them to approve a policy, and then each district had to. And so Ashley was able to create a very nice little kit for each school district that included the medication from Banner, the light air spacers from Thayer, and then all the forms that they would need to document their training, document when they had given the stock inhaler, and then also the College of Public Health Western Region Training Center and Dr. Doug Tarrin created the online training program for us. This was something that we had learned during the legislation process had been problematic with the EpiPen legislation, is how were people going to be trained. In-person training is very difficult for school nurses and school staff. They're very busy, so we wanted to make sure that we could have an online training. So we were lucky that the Western Region Public Health Center did this for us, and I think that's probably one of the big reasons that we were able to get up and running with the legislation being signed in April, but getting started in August in every public school in Pima County. Well, for me, this program is a dream come true. I mean, there's not many times as a researcher that you actually do something that can be easily and very simply implemented and make a huge impact in kids' lives. So over the 20 years that I've been working in schools with asthma, this was just such a simple, low-cost solution to really save lives and keep children in the classroom. And I had a lot of fun this year because I got to personally implement it. I'm the co-president of the band boosters for Catalina Foothills High School, and we have the largest band in the state. And so we implemented the stock inhaler for our band because we are often out on the field, we travel around the state, and we have kids that have misplaced their inhaler. And so I personally got to use the stock inhaler over 15 times with the Catalina Foothills High School band. We were at a competition at NAU. It was fall, so it was high allergy season. The kids performed, and then as soon as they performed, I got a call that we had 4 kids that were in respiratory distress at the same time. So we had the stock inhaler with the interchangeable, with the different mouthpieces for each kid, and we were able to treat all of those kids. 2 of them probably would have gone to the emergency room without the stock inhaler, but for me to personally also be able to see it in action was really exciting. So I hope that we are able to continue. I think the major barrier to continuing is funding. It was non-funded legislation, so schools are able to do it, but they have to provide the supplies themselves. The supplies are relatively inexpensive, about $60 for an inhaler, $20 to get started with some spacers, but still schools are incredibly cash strapped, so asking them to add anything to their budget is sometimes unreasonable. So that's what we're hoping to be able to do, is we've been able to do it in all schools in Pima County this year, but hopefully be able to expand it. I think, the good thing is all the major structural aspects are in place. All of the training's been created, all of the materials that schools need to do it have been created. The Arizona Asthma Coalition is maintaining all of these materials on their website, so they're easy for schools to access. The main problem is funding, and the funding is for the medication and for the spacers. Again, it's relatively inexpensive in terms of a single inhaler or spacer, but when you look at that statewide, it becomes, something that's difficult for school budgets to manage. So finding the funding for the medication and the spacers over the next couple of years would be fantastic. We're still willing to put in the work and help schools get up and running, and I think schools are willing to do what it takes to get it up and running. It's just having the supplies that they need.